Hi, I'm Dr. Rashmi Yogish, Clinical Director and Consultant, Khushi Fertility and IVF Center, JP Nagar, Bangalore. Primary ovarian insufficiency. We see a lot of women losing their ovarian reserve faster than their other women of the same age group. This happens in women who have had ovarian surgeries, which reduces their ovarian reserve, or in women who have a condition called as endometriosis. In endometriosis, the ovarian reserve falls at a faster rate than others, and this could also be because of an autoimmune bearing. Women who lose their ovarian reserve faster tend to have an early menopause too. Therefore, in women who have failing ovarian reserve or reducing ovarian reserve, they should venture things like intrauterine insemination and IVF earlier than others and achieve pregnancy as early as possible. Primary ovarian insufficiency or premature ovarian failure, it used to be called as in the ester years, can also be due to a genetic condition. In women who have their mothers and their maternal aunts, having menopause early should be very careful because they could be a genetic bearing because of which they can also have an early menopause, and therefore they should plan pregnancy faster. In some women, there are some mutations in genes, especially genes that are called as homeobox genes. The homeobox gene mutation can also be found out with the help of a genetic test which is called as the whole exome sequencing, which is just a blood test. With the help of this, one can find out if there is a family history, a strong family history of premature menopause, and if at all the homeobox gene mutation turns out to be positive, they should be very vigilant and plan for pregnancy as early as possible. Some women can have chromosomal problems like Turner's syndrome, where one of the X chromosomes is absent, or other conditions, other chromosomal abnormalities which will reduce their ovarian genesis or oogenesis, and therefore they can have something called as primary ovarian insufficiency, that is, the ovary is not functioning from the beginning. In such women, it is very difficult to rejuvenate the ovaries, and so they will have to resort to treatments like IVF with donor oocyte to be able to conceive. We have seen that a lot of women who have this kind of a primary ovarian insufficiency also have a very small size of your uterus because they would not be having the estrogen hormone from the ovaries to support the growth of the uterus, and when they don't regularly menstruate, the endometrial lining also turns out to be really thin. But in most of these women, when we give them hormone replacement therapy, we find that the ovarian lining as well as the uterus is quite responsive, and so with the help of the estrogen progesterone medications, they also have thickening of the endometrium, and they also get their periods regularly with the hormone replacement therapy, and this also helps to increase the size of the uterus. And therefore, women who have primary ovarian insufficiency should not be worried at all. They can take hormone replacement therapy or contraceptive pills for a few months, which will help to increase the size of the uterus. They can take serial estrogen and progesterone tablets cyclically to make sure the uterus lining also develops, and then once with the help of ultrasound scan, if they get to understand that their uterus has come up to a normal size and their uterus lining is also proliferating well, they can go for an IVF with donor eggs and achieve pregnancy. And once they are pregnant, they are like any other pregnant lady and they can continue the pregnancy to term without issues. And we have also seen that there are women who have been able to carry forward twin pregnancy to term after having taken the hormone replacement therapy. But ideally, in women who have had premature ovarian insufficiency or primary ovarian insufficiency, we usually ask them to go in for a single embryo transfer so as to avoid mishaps that can happen with a twin pregnancy, especially with the background history of a small uterus which they had before they took the tablets. Therefore, women who have small uterus, absent ovaries, atrophic ovaries, or premature ovarian insufficiency due to hormonal conditions or due to conditions related to their chromosomes should not lose hope and should venture for an IVF with donor eggs and achieve pregnancy and enjoy motherhood.